1. Which principle of adult learning emphasizes that learners bring prior experiences and knowledge that should be integrated into the CEM test preparation? A. Behaviorism. B. Experiential learning. C. Rote memorization. D. Passive reception. 2. In the context of evaluation, which method best ensures the reliability of CEM test scores across different administrations? A. Using norm-referenced scoring only. E. Applying consistent test administration protocols. C. Allowing flexible testing conditions for all learners. D. Using open-ended essay questions exclusively. 3. When developing curriculum for the CEM test, which approach best aligns with adult learners' self-directed nature? A. Teacher-centered delivery. B. Learner-centered planning. C. Strict memorization drills. D. Lecture-heavy sessions. 4. Which communication strategy is most effective for mentoring candidates preparing for the CEM test? A. One-way directive instruction. B. Open dialogue with feedback loops. C. Avoiding learner questions to stay on schedule. D. Providing only written instructions. 5. A critical component of regulatory compliance and standardized testing, such as the CEM test, is A. Allowing candidates to set their own testing times. B. Providing equal access and accommodations as required by law. C. Encouraging flexible grading methods. D. Allowing peer assessment for fairness. 6. Which evaluation tool is best suited for identifying a candidate's readiness for the CEM test? A. Diagnostic assessment. B. Summative assessment. C. Norm-referenced ranking. D. Randomized test selection. 7. In mentoring CEM test candidates, scaffolding involves A. Providing immediate answers without reasoning. E. Gradually reducing support as competence increases. C. Withholding all guidance to promote independence. D. Repeating instructions verbatim. 8. Which of the following best describes formative evaluation in the context of the CEM test? A. Assessment conducted at the end of the course only. B. Ongoing feedback to improve learning before the final exam. C. External audits of the testing center. D. Peer grading of completed exams. 9. Adult learners preparing for the CEM test are more motivated when A. Learning content is directly relevant to their goals. B. Learning is abstract with no immediate application. C. Memorization is emphasized over practice. D. Teaching is rigid and inflexible. 10. Which evaluation strategy would best measure higher-order critical thinking skills in CEM test candidates? A. Multiple choice questions with recall answers only. B. Case-based scenario analysis. C. True or false quizzes. D. Matching exercises. 11. When ensuring fairness in the CEM test, which practice supports validity? A. Writing culturally biased questions. B. Aligning items with stated objectives and competencies. C. Using ambiguous wording to challenge learners. D. Providing answer keys in advance. 12. A mentor supporting a candidate who struggles with time management during CEM test prep should A. Ignore the issue to reduce pressure. B. Provide strategies for pacing and practice under timed conditions. C. Extend unlimited test time. D. Suggest skipping preparation altogether. 13. In curriculum development for CEM test preparation, backward design begins with A. Selecting teaching activities first. B. Writing test questions before defining goals. C. Identifying desired learning outcomes. D. gathering learners' personal opinions only. 14. Which principle of andragogy emphasizes that adults prefer problem-centered rather than content-centered learning? A. Readiness to learn. B. Orientation to learning. C. Motivation by external rewards. D. Cognitive dissonance. 15. Which communication approach is most effective for providing constructive feedback on a CEM test practice exam? A. General praise with no details. B. Specific, actionable comments tied to objectives. C. Negative criticism only. D. Delaying feedback until after final testing. 16. What role does criterion reference testing play in the CEM assessment process? A. It compares candidates to each other. B. It measures performance against defined standards. C. It ensures test items are randomized. D. It predicts future group performance. 17. Which mentoring strategy best fosters self-efficacy in adult learners preparing for the CEM test? A. Encouraging reflection on past successes. B. Minimizing learner autonomy. C. Avoiding discussions of progress. D. Providing answers without explanations. 18. To maintain regulatory compliance during CEM test administration, test proctors must: A. Provide extra hints for struggling candidates. B. Follow standardized procedures without favoritism. C. Allow unmonitored breaks. D. Permit collaborative answers. 19. Which evaluation method best measures long-term retention of CEM-related concepts? Immediate recall quizzes. B. Delayed post-testing. C. Random guessing strategies. D. Peer discussions only. 20. The alignment of CEM test preparation curriculum with assessment objectives primarily ensures: A. Teaching efficiency over learner success. B. Validity of the evaluation process. C. Reduction of test length. D. Higher scores regardless of preparation. 21. Which principle of adult motivation is most important for sustaining effort during CEM test preparation? A. Extrinsic rewards alone. B. Intrinsic value of achieving competence. C. Avoidance of failure through memorization. D. Dependence on teacher control. 22. Which evaluation approach combines quantitative test scores with qualitative learner reflections? A. Mixed methods evaluation. B. Norm-referenced evaluation. C. Randomized controlled trial. D. Criterion-only testing. 23. In the context of curriculum development for CEM test prep, formative feedback loops are essential for: A. Identifying misconceptions early. B. Final certification decisions. C. Regulatory audits only. D. Avoiding learner engagement. 24. Which communication barrier is most detrimental when mentoring for the CEM test? A. Active listening. B. Use of jargon unfamiliar to learners. C. Encouraging clarifying questions. D. Summarizing key points. 25. When designing practice exams for the CEM test, item analysis helps instructors: A. Identify poorly performing test items. B. Eliminate test validity. C. Randomize results. D. Shorten the test without purpose. 26. Which type of evaluation focuses on the overall effectiveness of a CEM test preparation program? A. Formative evaluation. B. Summative evaluation. C. Diagnostic evaluation. D. Normative evaluation. 27. In adult learning theory, readiness to learn is most influenced by: A. External controls from the instructor. B. Immediate relevance of learning tasks. C. Arbitrary assignments. D. Memorization-only strategies. 28. Which mentoring technique enhances reflective practice for CEM test candidates? A. Encouraging journaling about preparation strategies. B. Limiting learners to only multiple-choice drills. C. Withholding opportunities for self-assessment. D. Ignoring learner concerns. 29. A key indicator of curriculum alignment in CEM test preparation is that A. Objectives, instruction, and assessment are consistent. B. Teaching is independent of assessment goals. C. Learners memorize unrelated content. D. Test items are unrelated to instruction. 30. When evaluating communication effectiveness in CEM test mentoring, success is measured by A. Learners' comprehension and application of feedback. B. The mentor's ability to lecture continuously. C. Reduction in learner questions. D. Focus on mentor authority. 31. Which strategy best addresses test anxiety in adult learners preparing for the CEM test? A. Guided relaxation and practice under test-like conditions. B. Ignoring anxiety to save time. C. Encouraging all-night study sessions. D. Reducing preparation to only last-minute review. 32. A common ethical issue in CEM test preparation and administration is A. Providing equitable access and confidentiality. E. Sharing answers before the exam. C. Allowing unqualified mentors to train candidates. D. Using outdated, biased materials. 33. The use of mentoring circles for CEM test preparation primarily supports A. Collaborative peer learning and mutual support. B. Isolation of learners for independent study only. C. Reduction of mentor involvement. D. Exclusive reliance on self-study texts.